Hello, everybody. I'm so glad that you join us today. I am Tiffany Roberts, and today we're going to learn the root causes of the thyroid disease. So, who am I? Who are we? My husband and I, Gabe Roberts, we own a functional medicine clinic in Prairie Village, Kansas, where we coach everyone back to optimal health, finding the underlying root causes of their issues. My husband is formally trained as a chiropractor, but has found a new passion through functional medicine because it definitely helps people reach their health goals much more quickly. And I am Tiffany Roberts, and I have a master's degree in nutrition, and I am currently working on 2 doctorate degrees, in one in health education professions, and the other one through Quantum University for natural medicine. So you can see that it's definitely a passion of ours to help others naturally, and we have 4 beautiful children that we stay very busy with. So why does this topic matter? Well, thyroid cancer is one of the fastest growing cancers in the United States, and 75% of those cases are women. And 98% have a 5-year survival rate with thyroid cancer. So this is concerning, and this is something that needs to be looked at in a more aggressive way than what is really being looked at now. Now, I do want to bring up some core values. We do not diagnose or treat disease. We co-create health, and that is much more powerful than labeling you with a disease. We find that getting to the underlying causes of your issues provide a much more healthy environment for reversing issues. And all chronic diseases have a root cause, whether that be your environment, whether that be your stressors, your diet, your lifestyle. Maybe it's an emotion that you dealt with previously. Maybe it's something that you're dealing with now. But whatever it is, there's a root cause to whatever you're experiencing. And the patient determines the outcome, not the clinician. We can give you the tools to guide you. We can give you all of the supplements to help reverse your issues, but it's ultimately up to you. You are the one that has to make the changes in your life, in your environment. So it's ultimately up to you to make that decision of whether or not to become a healthier place. So finding the right doctor. Many of our clients have come to us. They've already been to 12 other physicians, and some of those physicians are other functional medicine practitioners. But why didn't they, work for them? Why did that not work? Well, there's factors that can be determined for this. The Allopathic Society are looking at you as if you are mechanical. We will just remove this or give you a pill. But God did not make you this way, and they did not make you faulty. Many of these procedures do not work because it's not getting to the root cause. Other functional medicine doctors may be helping to improve some of your symptoms, but again, they're not looking at it through, they're looking at it through a symptom-based approach. It doesn't matter how many pills that you take, whether it's either chemical or natural-based, if you don't treat the underlying causes of the problem, and most of the time this is emotions, you will never correct the problem. So finding a doctor or a clinic that you feel comfortable with and have a connection where you and they are trying to give you as many tools as possible to empower you to a better lifestyle is highly important. So in this webinar, we will, look, who is this webinar for, okay? It's for many, many people. Someone that is looking for a root cause to their issues. That's highly important. Someone that's deeply values their time, because you don't want to waste your time on unnecessary procedures. Someone who's at the end of your rope. someone who has witnessed the limitations of healthcare so far, someone who is proactive in their health, because if you're not taking action, you're not going to get healthy. Someone who has had 3 or more of the following symptoms. And these are some of the thyroid symptoms that you can experience. Fatigue is a big one. Brain fog, low motivation. Maybe you're gaining weight and everything that you do is not working. Are you cold all the time, even if it's 100 degrees outside? That's a big indicator of a thyroid issue. Do you have depression or anxiety? Dry skin. This is another telltale sign of a thyroid issue. If you crave not sweets so much, I mean, you can crave that, but more particularly breads and pastas and crackers and things like that. Again, low motivation. Constipation is a big indicator of a thyroid symptom. So the list can go on and on about what can point towards thyroid symptoms. So let's look at a little bit of the causes. So I apologize if this picture makes you dizzy, but an important fact to note that is if you have an autoimmune disease or been diagnosed with it, then there is a chance that you might have other autoimmune issues. This image is a good indicator of whether or not you have something called cerebellar ataxia. This is an autoimmune disease of the cerebellum. This is the image. If it makes you nauseous or dizzy, then it's a good indication that you have a cerebellum that is under attack. And if it is making you dizzy, look away for a little while. This is caused by immune cells destroying cerebellum, which is not a good thing. 47% of people who have autoimmune diagnosis have other autoimmune diseases that are not diagnosed. The problem here is that there has to be a significant amount of damage before the symptoms show up, before the medical field will actually do something. So, what is the most frustrating symptom for you right now? Currently, this impacts 50 million Americans, and it's costing over $100 billion. And this is the #1 cause of suffering. So before we're done, you will be able to begin asking new questions. You will know the most common causes of thyroid disease. You'll understand why the current approach is failing and will fail many millions of women in the future. And you'll know exactly what testing to be done to, indicate whether or not you do have an autoimmune disease of the thyroid. And we'll take action to spare yourself years of needless suffering, okay? So the thyroid is an interesting gland. The thyroid hormone affects every hormone in the body. Every cell in your body has a receptor cell for thyroid hormone. So it becomes disheartening when this is overlooked or oftentimes it's mistreated. This can lead to many systems breaking down or not functioning properly. You got your brain with, fogginess and low motivation, depression and anxiety. Your heart can slow down or it can speed up, depends. You could get joint pain. Your sexual organs will have issues. You'll have low libido, PCOS. Your legs can start swelling. Your digestion slows down, and that causes constipation and bloating and low stomach acid production. You could start losing your hair or get brittle nails. And most commonly is your throat. You have a difficulty swallowing. Maybe you'll get an enlarged gland, which is called a goiter. So there's so many different things that the thyroid can actually, help or hinder. So there's many different mechanisms which cause thyroid disease. Not one person is the same in how we have traveled the path to this issue, and each of us have gotten to the end result in a different fashion. The true success is finding what path was taken to get you into this situation. Heavy metals can cause the thyroid to dysfunction. Chronic stress. Who does not have stress today? We need to lower that stress. You could get oral bacteria overgrowth, which causes autoimmune diseases of the thyroid. Chronic inflammation, leaky gut, digestive disorders, xenoestrogens, which are found in almost everything that we come in contact with, your cosmetics, your cleaning supplies, your laundry, everything that you have in your household could be affecting your thyroid. Gluten actually looks very similar to a thyroid hormone in the body. So we definitely suggest getting off of all gluten and maybe even getting off dairy. And then again, autoimmune attack. So we'll go into further discussion about that. 90% of hypothyroidism is caused by Hashimoto's thyroiditis. This is an autoimmune condition. This is not a thyroid condition. Your thyroid is actually the victim here. It's the victim of the immune system attacking it. So, autoimmune disease facts. This, again, I'm going to say this again. This is currently impacting 50 million Americans, costing over $100 billion, and is the number one cause of suffering in America is autoimmune diseases. So people all experience different symptoms. Maybe you could start writing down your symptoms and see how long your list is. Chances are a lot of them, are quite long. So in our office, when you come in and speak with Gabe for a discovery session, he will go over this a little bit more, but, this is a good graph to show when autoimmune really does show up. We're all born healthy, and then there's triggers. Maybe you have an allergy infection or virus or stress or even emotions. Emotions happen. So then the autoimmune starts to activate. And then we go into a pre-symptomatic phase. This is before you have symptoms, but you're in the orange. You're experiencing issues right here, okay? Then, only then, we go into the dynamic phase threshold and we start to feel our symptoms. We're in the red here. This is too far gone. Then we go into the degeneration part where they give you medications and surgeries, and unfortunately a lot of times cancer develops. So we need to get back to this healthy state, and it is possible. I just want to give you that hope that it is possible. When you have one autoimmune condition, you likely have multiple others. You don't just have one autoimmune. The thyroid is the last bucket to fill. Okay, I'm going to say that one more time. The thyroid is the last bucket to fill up and overflow. A lot of it can be connected to your gut. We always say that health begins and ends with a healthy gut or a not healthy gut. So there's multiple layers that need to be looked at and addressed before this can even be corrected or reversed. So keep that in mind. And this is a vicious cycle. You have a stress that starts, and then you become dysfunctional, and then you have symptoms, and then you develop disease, and then you go to the doctor and they slap on a diagnosis, and then they give you a treatment. Well, that doesn't work. That stresses you out. Then you have more dysfunction and more symptoms and more disease, more diagnosis and more treatment. Do you see the vicious cycle? It just keeps on going. So, do you or your doctor share the same definition of health? Waiting for a diagnosis to surface isn't focusing on your health. It's focusing on disease. So there are 3 drivers for autoimmunity, okay? Number one, they say genetics and epigenetics, but I don't know about you, but I like to prevent issues before it becomes a problem. When someone tells me or my husband that they have genetics for a certain disease, but their symptoms haven't shown up yet, I see two things wrong with this. One, you are telling yourself that you will get the disease. The mind is a very powerful thing, and if you convince yourself that you're going to get this disease, chances are you will, and vice versa, okay? And then number two, why wait for the symptoms to occur? Don't you want to prevent a further disease, thereby saving you money and extending your quality of life? And quite honestly, you know, your genetics are not something that should be excused for a disease. You can change your genetics. Our body is a majority of microbe genetics. They aren't even our own genetics. Your environment and your microbe play a larger role in your genetics than your parents do. So keep that in mind. Number two, chronic stress. Who doesn't have chronic stress? So let's look at this. How many of you have heard of the autonomic nervous system? I want to show you this information because it's really relevant. On the left side, you have the sympathetic nervous system, and on the right side, you have the opposite. The autonomic nervous system is a transmission in your car, let's just say. So what happens is all of our brains are, when information comes in, whether that is touch, vision, or auditory information, it gets processed through the amygdala. And then the amygdala makes a decision based on our past experiences of what we believe to be true. So imagine with me, if you will, a lion walks into the room. So that information gets processed into our brain. We would probably start freaking out knowing the information that we know. However, my daughter may go towards the lion. Same information being processed, but it's different. In an adult, we don't want to have to think about whether that lion is fed or angry or friendly. We need an instant decision. Before my daughter's conscious brain even knows what's happening, the amygdala, which is the decision-making part, is already decided what's going to happen to you. So it is decided that this situation is a bad situation, and it already sent a signal down your entire spinal cord to all of your organs, and all of your organs shut down. They are not going to save you from this lion. Where are they going to send that blood? Exactly, they're going to send it to your limbs because you need to start running, right? We take that blood somewhere so that we can take it away from the trunk, where we send flow to the function of our limbs, our arms and legs. As system in your body cannot function unless it's sent to your blood. Okay, so your organs cannot function unless it has a healthy blood flow, correct? So if you want your brain to function better, we need to send blood to your brain, right? So during this situation, what do your eyes do? If I'm under extreme amount of stress, do you want that information coming to your brain? You want more information coming to your brain, or you want less information coming to your brain? Do we dilate or contract? We would dilate. We want to know all the information coming around the situation so that we can focus on a wide area as much as possible. So if people are under stress, how does that show up? They go outside and it's too bright for them. They have to wear sunglasses. This is an outward sign that you probably have a constant state of stress. I don't have sunglasses. We don't go outside with sunglasses at all. What would happen to your saliva production? Would it increase or decrease? Your saliva production would decrease. People that are under chronic stress have less saliva. They experience dry mouth. Would your breathing capacity increase or decrease? Would you need more oxygen during that situation? In a stressful state, you probably have rapid breathing or short breaths, rapid breathing. How about stomach acid production? Would that increase or decrease? It would decrease because it's not focused on digesting your food at that moment. So kidney function would slow down in a stressful situation. Your blood pressure would increase. Detoxification functions would decrease. If you're stressed out, detox doesn't make sense, right? How about reproduction for organs? Would that function better or less? Less. How would your blood sugar be? Well, it would increase because it needs to bring sugar to the muscles so that you can run. Your immune system would decrease as well. It's not worried about healing you right now. It's worried about getting you out of that situation. Your body is smart. It does not need to do, it's here to just survive. Okay, it's not here to kill you. It wants to truly survive. So we've got to get you out of this fight or flight situation. Otherwise, you're not going to heal. Number 3 cause is leaky gut. This is also called intestinal permeability. It is the cause of all autoimmune diseases. Virtually every person with autoimmune disease has a leaky gut. This is the sacred barrier. The contents of your digestive tract should stay within the digestive tract, unless those are, nutrients that actually need to be absorbed in the body. This barrier is like a screen door on your window. This is keeping all those bugs out, all the mold and all that stuff out of your screen door, whatever. The bugs are too big to cross that screen door, so it keeps it out. However, if you have a hole in that screen, then the bugs pass freely. And when you have signs of leaky gut, you have digestive problems, foggy brain, low energy, weight gain or weight loss, bloating, IBS, skin issues, joint pain, the list can go on and on. So let's look at a little bit of what leaky gut is. For demonstration purposes, leaky gut kind of looks like this. We have a single layer of cells that line our intestinal tract. This layer of cells creates that barrier. So imagine the cells are holding hands, which create a tight junction. Ideally, we want bugs and mold and yeast and undigested food to skim across the top, to not pass through. We don't want those entering into the bloodstream, okay? When the barrier becomes compromised, that leads to these proteins and molecules that enter into the bloodstream where they shouldn't be. Now the immune system has to deal with that stress. The way that a body heals with that stress is a process called inflammation. So every time the immune system becomes activated, there's an inflammatory response because those foreign objects shouldn't be there. In a healthy gut, that has a healthy microbiome, and this barrier is intact. Having a healthy gut is so important. People who are stressed out, nutrient depleted, or who have dysfunctions going on, what that leads to is a compromisation in this barrier, which then allows things to get into the bloodstream that should not be there. Okay, that's called leaky gut. In this study, you can look it up on PubMed. This is referencing how there is a correlation between leaky gut and autoimmune diseases. And if you do look it up on PubMed, just type in leaky gut, and you'll find out that there is a correlation between this and many other diseases. So what happens next? We're waiting for a diagnosis to surface instead of focusing on your health. Well, how do we identify this process before it turns into a more severe problem? You don't want to have all these symptoms, but if you do have these symptoms, it's time to act now to get these symptoms under control. You ask the right person the right question, and they do the right testing, right? Wouldn't it be nice to find out earlier that this could be reversed? Well, it definitely can, but it takes a lot of work, okay? This is the fastest rising form of cancer. And like I said, today, if you're diagnosed with one autoimmune disease, it really means that you have multiple autoimmune diseases. It could be autoimmune of the liver, autoimmune of the pancreas, which will develop into type 1 diabetes. It could be autoimmune of, the thyroid. Everything could be under attack. It's not just one thing. We learned today the mechanisms of thyroid disease and the most common causes of thyroid disease. And then what's the drivers? Genetics, epigenetics, you have chronic stress and leaky gut. Those are all major contributors to autoimmune disease. So here's some questions for you. Do you see why the current approach is failing people miserably? And I hope you do. Do you see why finding a new doctor in a broken system will, never fix the issue? It's not going to fix the issue because it really boils down to the patient. But you got to have a good guide to know what to do. Okay, your doctor should be your partner, not someone that does everything for you. Do you see a new opportunity to go upstream to find the cause? Do you see why thyroid disease may be actually a blessing in disguise? Because if you do have a thyroid disease, that means that you have other issues, but that's a blessing because you can catch it before all those other issues become symptoms and into disease. So do you see hope in the possibility of a better future? I sure hope you do, because we are here to help you find that hope. So before we're done, will you be asking the new questions of your doctor? Hopefully you'll be able to ask them. And if they don't know the answer, then find someone that does. Do you know the most common causes of thyroid disease? If we went through this too fast, then I will suggest that you go through the replay of this video to find out the common causes. And do you understand why our current approach is failing? And failing millions of women, okay? Do you know exactly what testing that needs to be done? Finding a doctor that really does know what testing needs to be done, this can help you end a lot of your suffering. There's two good ways to test for the leaky gut or the thyroid issues. This one is an old way to do it. You can do blood testing, and you can do this comprehensive examination process, and you can do it through a saliva testing. Saliva testing is actually more accurate than blood testing for a thyroid issue because it has so many other different markers. Did you know that there's more than just T3 and T4? There are way more markers that show a thyroid issue. You need to look at all of these issues here, and they will look into, is corn causing it? Is egg causing it? Is it an environment? Is it heavy metals? There's so many. Is it a virus? Viruses are very common, especially in the thyroid, and those need to be kept under control. So, like I said, saliva collecting instead of blood can be done at your home, and it's non-invasive. There's a broader screening for overall health, and you can go further upstream to see what the underlying cause really is for your autoimmune disease. So again, going back to finding the right doctor to help you sail down that right path to help. What are our next steps? Well, you have two options, okay? You can call our office for a 60-minute discovery session. This can be online or in person. Once that is completed, then you can decide whether or not you want to move forward. And when you do, we do video lab interpretation for your findings. We can review previous lab work. We'll give you a 30-day health guide. We'll do annual blood work checklist and give you a new lease on life. So the next steps is to decide if you're choosing a healthier path today. And if you are, then go to functionalmedicinekc.com and book that first discovery session to see whether or not, our office is a good fit for you. See if we are a good partnership for you. If you decide to move forward after that, then decide to move forward with an examination and your testing. And we'll send you the forms for you to fill out the intake form, and then we'll set up the consultation with all your results once they arrive. Again, it's functionalmedicinekc.com, and you can book an appointment at your convenience right from that website. And I wanted to thank you so much for joining today. Reach out to us if you have any further questions, because we are here to answer your questions and be a partner in your optimal health. Thank you so much for joining today.